Hey, thanks for joining us at Mums at the Table. We're just sitting down with Dr. Simone. We are talking about sudden infant death syndrome, something that has affected quite a few families over the years. I know in the 80s and 90s there was major campaigns to reduce these incidences.
And that's where we get Red Nose Day and those sorts of things coming from.
Yes.
Look, it must be one of the most gutting things to lose a child. You can't imagine how that would feel. And so looking at factors that can contribute to those sudden unexplained deaths is really...
Because that's exactly what it is.
Unexplained.
You just wake up and...
your child is not alive. And it's absolutely devastating. So the things that we know about SIDS so far, we know that children who are born, babies who are born premature, are at a higher risk of sudden infant death syndrome of SIDS. We know that babies who have a low birth weight are at a higher risk of SIDS. The other big factor that I guess the biggest...
These are things that are out of our control, though.
Absolutely. There are things that are within our control that we can try and modify to reduce the risk of our children suffering with SIDS. And the biggest thing that we can do is provide our babies with a smoke-free environment. Okay. And that means that if you are a smoker, please don't smoke inside the house. Yes. Always smoke out. Heck, have a chat to your friends or family, or have a chat to your doctor about ways that you can be helped to stop smoking, because that's going to be the best option for your child.
So important that it's a smoke-free environment for our children.
Smoke-free environment, absolutely. The other things that are really important as factors things that we can modify to reduce the risk of SIDS: make sure that your baby is in a firm and empty sleeping space. Okay. And ideally they should be the only person in their sleeping space. That's not to say that you can't co-sleep safely. There are strategies around that. Yes. But ideally your baby should be in their own space without any toys or pillows or bumpers or those sorts of things. You don't want anything loose that can potentially obstruct an airway. Okay.
What about the swaddling techniques for babies? Because, you know, we're always taught to swaddle our babies when they're younger. So is there a certain time or that we should stop swaddling, or is there something that we can do to prevent SIDS with our swaddling?
So swaddling is a really important settling technique for babies, and a lot of babies utilise that to help them to soothe off to sleep. You want your swaddles and you want your baby wrappings to be firm. Again, you don't want loose coverings that can come over a nose or a mouth and obstruct, make your child's breathing any harder than it absolutely has to be. Some babies also really like sleeping on their tummies, and it feels really mean to try and sleep them on their backs.
My babies were naturally stomach sleepers. I felt like, now I'm speaking to you and I'm thinking, really? I should have been placing them on my back.
And so we do our absolute best, and sometimes we can, settle them and sleep them on their tummy and then roll them onto their back.
So just reiterating the 3 main tips for keeping our kids safe.
So the first thing is a smoke-free environment. The second thing is a really firmly wrapped baby on a firm surface with no other things around them is the best way to keep your baby safe.
Yeah. Thank you so much, Dr. Simone. I'm sure that's helped you. Don't forget, keep it locked right here, Mums at the Table.